This presentation will serve as a basic overview of how we properly secure and maintain urinary catheters in order to prevent complications, ensure comfort, and avoid unnecessary emergency room visits. Before we begin, let's talk about urinary catheters. Urinary catheters play a vital role in managing various urinary conditions. Understanding their purpose, types, and proper care is essential for well-being. A urinary catheter is a flexible tube that is inserted into the bladder to drain urine from the body. Catheters are used to manage various urinary conditions, such as incontinence or retention. There are several types of urinary catheters, including Foley, intermittent, and suprapubic catheters. Each of these are designed for specific medical needs. Proper maintenance of urinary catheters are crucial to prevent complications like infection, blockage, and dislodgement. A component to avoiding catheter complications is to make sure it is in place and doesn't move. If it does move, it can cause a lot of pain. It may also not drain well, which can lead to infections or other serious complications. The best way to make sure it stays in place is to secure the catheter tubing so it doesn't get pulled or tugged. In our facility, we use a device named Statlock. As you can see, the securement device is holding the catheter with a clamp. Should it need to be changed, or if it becomes loose, notify the RN consultant. Here are the steps to properly prep the securement device and secure the catheter. First, thoroughly clean the area where the securement device is to be placed with soap and water. Then dry the skin completely. After cleaning the area where the catheter tubing will be secured, put a thin layer of barrier film on the skin to protect it from the adhesive. Place the securement device on top of the barrier film. Then, secure the catheter to the individual's thigh using the securement device. Make sure the catheter is not bent or pulled. When you place the catheter tube into the securement device, make sure there is no tension or pulling on the tube. You also need to leave some slack so that the tube isn't too tight. Make final adjustments and anchor the catheter tubing to the individual's leg using the securement device. Evaluate movements to ensure the line is not tight or pulling. Statlocks are great for securing catheters, but you still need to keep an eye on the individual. You will need to observe individual to ensure that their movement is free and not hindered by the catheter. If the catheter is causing discomfort or pain, notify the nurse. When transferring a person, be careful not to pull on the catheter or dislodge it. Always be aware of the catheter's presence. Even though the Statlock is holding the catheter in place, it's still possible for it to get pulled out near the entry site. So, be sure to keep an eye on the catheter and take steps to keep it from pulling out. Catheters can easily get tangled with clothes. When dressing someone with a urinary catheter, it's important to pick clothes that fit well and won't cause the catheter to come loose. This is one of those topics that's best taught hands-on, so let's get to it.